Hello dear colleagues, now it's turn to put all the knowledge that have been already trained into the clinical practice. And for that we'll be playing a different model, which is a stone, where we'll be able to place different dental implants where all the biological and technical principles in terms of position and also in terms of drilling and placement will be applied step-by-step approach. So for that we have Mrs. Monje, who's going to be assisting us, and we'll be doing that in different scenarios. So we're going to be placing a Ticare Inhex dental implant in a molar position and then in the anterior aesthetic area. So hopefully you can capture which are all the principles in order to succeed in implant therapy. So some of the biological principles that should be fulfilled in placing dental implants are related to implant position. For instance, it is well known that at least from the mesial or distal, the more marginal aspect of the dental implant to the adjacent teeth should be at least 1.5 millimeters. This is in order to maintain a sufficient space in between the periodontal ligament, the cortical bone, and also the cancellous bone. In what regards to the baccolingual implant position, in the bacal aspect, at least 1.5 millimeters should be maintained, and in those scenarios where cannot be guaranteed at least a critical bacal bone thickness of 1.5 millimeters or 2 millimeters, which refers to the thickness of the cortical bone, simultaneous guided bone regeneration has to be applied. It is not recommended to go too far palatally, otherwise the emergence profile will be challenging to be restored. And then also in the apicocoronal direction, the implant is advocated to be placed at least 1 millimeter apically or subcrestally when compared to the crestal, never trying to exceed about 5 to 6 millimeters from the adjacent cemento-enamel junction. But having said this, it is important always to remark that implant placement, implant position has to be driven by the prosthetic emergence profile in order to provide an harmonious outcome. So now we're going to start the implant placement stage in a molar site. Again, you have to get a probe or a caliper in order to anticipate at least 1.5 millimeters. But of course, the implant position has to be, again, driven by the emergence profile. So in a molar site, it's going to be about 6 millimeters from one side, 6 millimeters from the adjacent side, in order to anticipate the implant placed in the center. So for that, the first burr that has to be used is the pilot drill. And with this, it is desired only to dig up to 4 or 5 millimeters. So the entire length should not be drilled up to the second drill, which is going to be the 2 millimeter drill. So it is suggested to apply about 900 revolutions per minute to 1100 revolutions per minute during drilling of in order to place these bone level implants. And for that, we're going to be determining which is the ideal position. So according to the standard that I already provided, we're going to have about 6 millimeters, and we're going to be placing it right in the center. And of course, trying to guarantee at least 1.5 millimeters, but the more the merrier. Same for the palatal side. And now once we have ideally marked which is going to be the final implant position, the first drill has to be applied right in the center of the alveolar bone with profuse irrigation. Of course, this is not applicable here in this model, and the motion has always to be following an in and out motion in order to get rid of all the debris related to the bone, and in order to have an irrigation to the apical portion of the drilling area in order to minimize overheating. Now it's time to use the second burr, which is the 2 millimeter diameter drill, and in order to anticipate the final implant position, it's recommended to use this caliper, to use this measurement replica, in order to know that if the final implant length that will be used is about 1.5 millimeters, and we have said previously that it's always desired to sink it about 1 millimeter more, I will be drilling up to 13 millimeters, okay, roughly 12.5 to 13 millimeters. So I will have that millimeter extra in order to submerge the dental implant, and that's what I'm going to be doing accordingly. Take your time in order to treatment plan, because that's going to be what will dictate success in the short and also in the long term. So again, it should be following a parallel direction, and after you have selection, which is the ideal drilling revolutions per minute, it should be applied in an in and out motion in order to get rid of all the debris. At this stage, you can also use a pin in order to check the parallelism and in order to verify that the position is the ideal in a three-dimensional basis. So here you can see that it follows the parallel alignment of the adjacent molars, and also check it from the occlusal point. It will be coming out from the cingulum if we will place in the anterior area, from the mid aspect of the molar, considering that we're going to be replacing here a molar. Now we follow, and as I have said during the presentation, this cassette is very intuitive since it's color coded, and so it's just a matter of following the sequence. So we have already gone through the 2 millimeter drill, and then we're going to go through the blue path in order to reach the 3.75 millimeter diameter implant, which is going to be the one that will be placed. So we call it the second drill from the cassette. My man kindly place it, and now it's time to continue the drilling again with profuse irrigation. You have to check parallelism, in and out motion, in and out motion, in and out motion, in order to minimize overheating, which can compromise the stability of the bone. Great. And now it's time to move forward because we are following the blue path. Okay, so you can see how easy is the system in order to place dental implants in a predictable manner. Okay, so this is going to be my last drill. This is going to be a 3.3 millimeter diameter drill for a 3.75 diameter implant. Then we have two different alternatives, which I will provide you, which are my suggestions in order to be used. Okay, great. In and out, take your time. That should be always the message. Okay, and here you can see how it was drilled right in the center of the alveolar bone, warranting a decent distance from the adjacent teeth, and also in order to guarantee an adequate emergence profile, which should be avoid always the convexities in the molar areas in order to minimize food impaction. Now, what is the next step? In a hard bone, type 1 bone with, we can say, with a very thick cortical layer, this drill will be recommended in order to drill up to 3.5 millimeters in diameter, and so minimize the friction and the trauma during implant placement. We're going to apply it accordingly, simulating that we are placing an implant in the posterior mandible, where the bone tends to be very dense in terms of quality, and where the cortical bone layer should be pretty thick. So again, up to the working length. And now the latest step, which I believe it is really crucial, it's going to be using the profile burst. Okay, the profile burst will minimize the trauma and will minimize the friction during insertion in the coronal area, which is always going to be the more susceptible in order to have changes in the short and also in the long run. Because the cortical bone is less vascularized and it tends to undergo to a process which is well known, and it's called a vascular necrosis. So this physiological bone remodeling is the one that we have to minimize by means of using Ticare Inhex dental implants and also by placing them in the adequate position together with an adequate drilling protocol. So it will be drilled with 100 revolutions per minute. Okay, and now that has been achieved this passive insertion in the coronal area, now it's time to place our Inhex dental implant. Again, will be slightly submerged at about 1 millimeter subcrestally, and will be placed at about 25 to 40 revolutions per minute, never exceeding 50 revolutions per minute. Is not really recommended. So for that, we're going to be opening our Inhex dental implant. We will be collecting it from the case where it's stored. It comes together with a cover screw, which it will be recommended to be placed in those situations where the primary stability is not really high. Otherwise, a Helena abutment can be placed. So for that, the device in order to place the dental implant has to be again collected from the cassette, and our assistant has to be trained in order to get it. And now it's time to place the dental implant. I'm going to be placing it with 40 revolutions per minute with an insertion torque of about 40, okay, 40 newtons per centimeter. Now with no irrigation whatsoever, and it's time for implant to be positioned in the ideal position, and also considering that the drilling has been appropriate in terms of sequence. Now we can slightly submerge it about 1 millimeter subcrestally. There we go. In order to guarantee the placement of the prosthesis on top of the implant subcrestally, and together with the gap zero, with the minimal bacterial infiltration in the gap in between the crown and the implant, I'm confident that will be resulting in a minimal to no bone remodeling process, which in the long term will be translated into minimal risk of biological complications. So now we grab the screwdriver and we remove the top area of the implant in order to make sure that we have the implant placed in the ideal position. In case that you wish for any reason at this point to place it slightly more subcrestally, you can place it over again. You can place it over again, you can adjust it, and it's time for you to apply either a higher revolution torque or a higher insertion torque, or even within the same torque, but just submerging it. That's according to the drilling protocol that you have used. That you can see that is very flexible, this dental implant, okay? So now we're going to be placing the cover screw, which is within the same case, and you can use the same screwdriver. My suggestion is the following. You can also check primary or mechanical stability by means of placing the cover screw. So you can apply some pressure when placing it, and in order to validate the adequate achievement of primary stability, which is key in order to guarantee secondary stability. And here you can see the ideal three-dimensional position, not only in the baccolingual and the mesiolingual perspective, but also in the apicocoronal perspective. Okay, and now we're going to make the same sequence for the anterior area, so you can capture which are the which are the tip and pearls for implant placement in the aesthetic area, where the emergence profile is even more critical, considering that it's not only about preventing biological complications, but also aesthetic disorders. So again, we'll be follow the same principles. We're going to be placing a 3.7 millimeter implant in order to replace a lateral incisor. So we have about 7 millimeters. Right at the middle will be about 3.5 millimeters, and I'm sure that with this implant diameter we'll be able to somehow compensate the distance in between the canine and the central incisor. Again, you have to keep in mind the importance of the alveolar bone dimensions in a bacolingual perspective in order to warranty at least 1.5 millimeters in the bacal aspect. And then the drilling sequence is going to be exactly the same, very intuitive. First of all, we start at 900 revolutions per minute in the central area. Okay, and check yourself whether the implant position is being drilled in the desired area, always considering that the emergence profile should be at the level of the cingulum in order to make a screw retain retain prosthesis. Minimize the use of cement, otherwise it may result in a residual cement, which is also associated with per-implant disorders, biological complications. Again, we're going to be drilling down to 13 millimeters in order to place it slightly more subprestally, aiming at drawing an adequate and harmonious emergence profile for replacing a lateral incisor. Thank you. We go for the second drill, which is the 3 millimeter diameter drill. Okay, and you have to make sure at this stage that the implant position is the right. For that, again, you can use the drill, the pin, and here you can see that the cingulum position is the one that is being done, and that also in the mesiolingual perspective and in the bacolingual context are within the standards. So you follow the same protocol, which has been, of course, tested in order to guarantee that there is no overheating while drilling, and that the implant will be inserted with an adequate insertion torque and will be achieving adequate primary stability, but not very, very high because it's not really desired, considering that the implant is a parallel wall dental implant. Please follow the same sequence, right in the center. And now again, imagine that the bone is very dense. You can either go just for the 3.5 millimeter drill, or you can go for the profile burr. Now, if we imagine that we're going to place a provisional prosthesis, it is desired to have a higher insertion torque, not higher than 50 Newton centimeter, but perhaps higher than if drilled with a 3.5 millimeter burr. Therefore, I will compensate for any friction that is triggered during implant position only in the coronal area, and this is the reason why I'm going to move forward towards the use of the profile burr at 100 revolutions per minute. There we go. Okay, perfect. Perfect. Okay, time for implant placement. Again, you can check which is the recipient site and how it has been prepared according to the standards. But in case that you have a thin bacal bone because of the collapse of the bacal area, you can always apply the principles of guided bone regeneration simultaneously. Okay, so now we're going to be placing the implant. Now it's going to be preparing the transfer. And again, the Ticare Inhex dental implant will be subtracted from the case. By the way, this implant surface, the Inhex implant surface, in terms of the topographic characteristics, has shown to have high bone to implant contact, which again will be assisting in the osseointegration process. So it's placed right at the ideal position, and now it's time to move forward towards the ideal position. You can see how I have moved the dental implant slightly more towards the palatal in order to promote, there we go, perfect, in order to promote the emergence profile coming out from the cingulum position, which will provide a benefit in terms of aesthetics. And now again, we'll be checking the apicocornal implant position. We help ourselves with the screwdriver. You can see the ideal position in terms of the bacolingual, having at least 1.5 millimeters, mesiodistally at least 1.5 millimeters, and 1 millimeter sink into the alveolar bone. So now it's time to place the cover screw and promote the cellulite healing. The healing period varies, but I will suggest to go for 2 months of healing. If you achieve a decent primary stability, if there is insufficient primary stability and still you have some horizontal movement when placing the cover screw, I will suggest to wait at least 3 months. I am confident that this has provided many of the tips in order to manage this special dental implant in an adequate manner, and that this will provide very successful and predictable outcomes in the long term. So I wish you all good luck, and I hope to see you soon in China. Bye bye.